6:21, and it is For Your Health Tuesday. This morning we're joined once again by Dr. Lacagnina, and he also brought Mr. Kurt Gerke from the American Lung Association because we're talking about the effects of smoking. So, Dr. Sal, we'll start with you. What are some of the health risks that are associated with smoking?
Right. Well, obviously most people know that there are cancers, and it's not only lung cancer. There's a high association with bladder cancer and colon cancers, so the risk there is significant. And then obviously the emphysema, what people know as COPD or emphysema, chronic bronchitis. And the concerns there are with the chronic bronchitis and the emphysema, you have a long time of being sick. With cancers, you usually have a short time and people die early, so that's really the concern. But, you know, you really can't get away from the chronic effects. Either you're going to die early or you're going to die late, but it significantly changes your life.
Now, Kurt, what are some of the things that the American Lung Association is doing in order to get the message out?
Well, it's one of our main messages because, unfortunately, in the United States alone, over 400,000 people this year will die of smoking-related illnesses, and it's been named the #1 preventable death and illness factor in the United States. So we work really hard at convincing people that they can quit. Because the truth is, most people who smoke do want to quit. Our statistics show that last year, almost half of the smokers had an attempt at trying to quit. So it's not even so much that they don't know that it's bad. It's that, how can I do it? And it's not easy to do, but it's doable. One of the great statistics is, for the first time in our country, there's actually more ex-smokers in the United States than there are current smokers. And I always say that's good news if you're a smoker, because there's nothing that they have on you. If they did it, you can do it too. And it's a matter of, you can't just sit back and hope it's going to happen. You have to decide you want to quit, and you have to find help. Generally, people need to go through some kind of a support group, behavioral modification. And then there's more aids than there's ever been, like nicotine replacement patches. All those things can help, but I think it comes down to, you have to decide that I want to do it. And if you fail, so to speak, at an attempt, you have to see that as one attempt towards, because most people take 3 attempts now on average before they can succeed.
Okay. Now medically, Dr. Lacagnina, I mean, let's talk about that mental status. How important is that? Because you can use all the Nicorette and all of those different products, but I mean, mentally, do you really have to be there in order to make this
absolutely.
happen?
You know, with changing your lifestyle, you have to be ready. So whether we're coaching someone to get their heart disease back in shape, or anything related to lifestyle, you really have to be prepared. So they usually say, set a date, know when you want to stop quitting, give yourself a plan, try to wean off the cigarettes. There are certain things that you can do, and that's when, you know, working with a lifestyle coach is actually really helpful to do that, because this is a significant lifestyle change for you. But you will add years to your life by doing this.
Now, real quickly, let's talk about the Fight for Air climb.
Yes.
I mean, real quickly.
All right, thank you. We have on April 28th an event that's a fundraiser for the Lung Association. And unlike a walk or a run, it's a climb up a building. We're climbing up the High Point Tower, which is the tallest building in Southwest Florida. 30 flights, 541 steps, great physical challenge. We have some ex-smokers that are doing it, kind of taking the next step of getting exercise, but we welcome anybody, and Dr. Lacagnina is one of our great climbers. I'm an example of the ones that just want to climb and live through it, so we welcome everybody, and it's a fun event.
All right, well, thanks, guys, for coming out. We appreciate
Thank
some
you.
great advice for people who are looking to quit this morning.
Thank you.
Thank you.